Bismillahirrahmanirrahim. I am Dr. Muhammad Tariq Farman and I am Associate Professor at Department of Cardiology, Dow University of Health Sciences. We have received a few questions regarding our discussion about congestive heart failure, and I will try to answer them. So the first question is, do we start ACE inhibitor and beta blocker at a time in patient with heart failure, or we go step by step? In principle, we should start our treatment with ACE inhibitor and diuretics, like vasodilator and diuretics, and then in the next step we should start beta blockers. But there is no hard and fast rule. If your patient is presenting to you with heart failure with preserved ejection fraction, and you suspect that there is an element of ischemia with heart failure, so you can start beta blocker if the BP allows you. So you can start beta blocker with ACE inhibitor. So in principle, yes, you should start treatment with ACE inhibitor and diuretics, and then you add beta blocker and start with low dose and go slow. But if you suspect the ischemia is an element which is worsening the heart failure, then you can start beta blocker as well at the same time. The second question is that if patient condition does not improve while taking ACE inhibitor and beta blocker, which third drug we prescribe? You can add nitrates and diuretics along with ACE inhibitor and beta blocker. After prescribing ACE inhibitor and beta blocker, how much time on average patient takes to improve? Usually within a week or two, your patient will be improving if you start the treatment with ACE inhibitor and beta blocker. And if your patient is not improving, then you should work up to find out the cause of heart failure. Is intracardiac defibrillator placement is done in Pakistan? Yes, it is very much present in Pakistan, and in every tertiary care center with cardiac facility it is available, in public sector hospital and in private sector hospital as well. In Karachi, there are various centers where the electrophysiologists are present, and they are doing this device therapy of heart failure. Is there any difference between ICD and CRT? Yes, ICD is an intracardiac defibrillator, and CRT is a cardiac resynchronization treatment. So ICD is placed to if you are suspecting that your patient condition will be worsening with arrhythmias, life-threatening arrhythmias. So you can put ICD, and cardiac resynchronization treatment is advised when there is a bundle branch block, especially left bundle branch block is there, and there is a dyssynchrony between the left and right ventricle, and they are not depolarizing at the same time. So this is the cause of worsening of the heart failure. So you advise CRT in those patients. But there are devices we have in which both the functions are present, and that is called CRTD, cardiac resynchronization treatment with the defibrillation facility. And this facility is also available in Pakistan and Karachi and every big city and every dedicated cardiac facility tertiary care center. So with this, I would like to thank the following trainees for their questions. Dr. Khalida Mukhtar. Doctor would like to thank the following trainees for their support in the question and answer screening process: Dr. Sayambat, Dr. Fizza Yasir, Dr. Anam Zaidi. This is the end of live question and answer session for e-lecture, Congestive Heart Failure by me. Thank you so much.